presentation this afternoon. Thank you all for coming out. Great turnout. It's my pleasure to introduce Dr. Laura Stachel, who has been working in northern Nigeria, working on maternal health and improving maternal health using some solar power. Dr. Laura Stachel is a registered obstetrician gynecologist in California, and she's also right now working on a doctorate in public health. And I heard her speak last June at a conference that was organized by the IEEE, which is the professional organization of the electronic engineers. And I just found her presentation very moving and inspired me to reach out to the nursing faculty and students here. We now have a joint project going on between the electrical and computer engineering department, the nursing college, and also the business school. So we're excited about this collaboration, and so I look forward to you also being moved by this very passionate speaker and seeing the impact with just some relatively low-cost technology that you can have on people's lives and maternal health. So let's welcome Dr. Laura Stachel.
Thank you all for being here. I can't tell you how much it means to me that you've all taken time to be here. And we're just trying to let you see what healthcare in Nigeria is really like. We are going to turn the lights down in a moment because some of the pictures I'm going to show you are really taken from the fieldwork that I've been doing for my dissertation at UC Berkeley, which is really focused on emergency obstetrical care in developing countries. And so for that, dimming the lights is actually going to be appropriate. But what I wanted to say first is just thank you for being here, because to be able to get to share what I'm doing with so many people just means a lot to me, and I hope that it will give some of you ideas of doing your own projects. I'm both an obstetrician gynecologist. I was in practice for about 14 years, but then I went back to school, and I'm now a student like many of you. I'm in a graduate program at UC Berkeley at the School of Public Health, and that's what brought me to Nigeria. And there's a number of things I'm going to try and get across today. I know there's a range of people in the audience. Raise your hand if you're connected primarily to healthcare, nursing or healthcare. Okay, what about engineering? Woohoo. And business. And what have I left out? International development, anybody there? And how many of you have gone abroad as part of your education here? How many of you have been outside this country so far? Okay, how many of you would like to go abroad? You thought about that? Great. Well, we'll hope to have every hand up by the end of the lecture. So you can see there's a diverse audience, and because of that, I was talking to Dr. Singh before we started to say, how should I orient this? Should I focus on health? Should I focus on engineering? Should I focus on how hard it is to do research and what the rewards are of research? And he said, yes, 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 yes. So you get the marathon talk, okay? There's going to be a lot. I have a lot of slides. Most of them are pictures. I also want to leave time at the end to ask questions, but I want to take you on the journey that I went on and how I ended up coming to Nigeria, why this project came about, what we're doing, what works, what doesn't work, and sort of bring you up to where we are right now. And it's not a closed story. It's definitely just the beginning of a journey. And it also may be that some of you will be able to join this particular journey because it looks like we really would like to do some collaborative work with your school, which I've had the good fortune of spending the whole day here, and I am so impressed with what you have. And you should know that this is an amazingly special place. And you have things that are available to you, resources and people that just are not available at lots of schools around the country. So I'm really impressed, and I'm just delighted to be here. So now we can turn down the lights, and I'm going to take you on the first step of this journey. That picture there, can you turn the lights down even lower? So you're not going to see me very well, but that would be good if you can. So this is basically the light in the maternity ward at the hospital in which I was working, and I'm going to tell you a little bit more about that in just a moment. But first of all, what I want to do is talk to you a little bit about the issue of maternal mortality. Anybody in the room know how many women die every year in childbirth? Okay, anybody know? Okay, more than 500,000 women die every year just trying to have a baby. And for every woman who dies, 20 or 30 more suffer consequences, sometimes severe consequences. Things like vesicovaginal fistula, where they end up leaking urine for the rest of their life because of their permanent hole between the bladder and the vagina. Or things like foot drop, where they can't walk because their nerves got paralyzed by the pressure of a baby trying to come from the birth canal for days and they couldn't get to. So maternal mortality is a very serious problem, and if you were to look at the map of the world and say where are the areas where maternal mortality occurs in the greatest amounts, it actually looks very much like if I showed you a map of where poverty is the greatest in the world. They tend to go hand in hand. So Asia and Africa are the places where the highest rates occur, and if we were to redraw the world map to show the territories that contribute the most to maternal mortality, oh, I don't have that map, sorry. There's a map that I often show, which just sort of balloons out and shows you that sort of Africa and India just become enormous compared to the landfill of the rest of the world. So why are women dying? I think before I went to Africa, I assumed that women were going to be having very rare and unusual conditions. But actually, it turns out that women die from complications that we see all the time here in the United States as well. Things like bleeding, which may not be predictable before someone goes into labor. Eclampsia, which is a condition related to high blood pressure. In this country, we treat a condition called preeclampsia. We notice during prenatal care when women have high blood pressure, treat the blood pressure and try and deliver babies before what's called eclampsia. Eclampsia is when someone actually has a seizure. And as a point of fact, I never saw eclampsia here in this country. In my first 2 weeks in Africa, I probably saw about 10 cases because they aren't getting the prenatal care to prevent this from occurring. Other causes include infection and also obstructed labor. Obstructed labor is when the baby's too big to fit through the birth canal. And these are things, as I said, that occur in the United States, but we have such good access to health care that we really don't associate these as life-threatening conditions. I was asked to join a project that was in Nigeria in early 2008, and I said yes before even knowing where Nigeria was in the world. And so I wanted to show you on this map that Nigeria is actually the country kind of in West Africa. I don't know if you can see it there, and I'm going to have a pointer, but it's right near Cameroon. And if you were to look within Nigeria itself, I'm working in northern Nigeria in the city of Zaria. Now, Nigeria has a lot of Muslims and also Christians. The northern area tends to be more predominantly Muslim. And it's a country that actually is the 5th largest supplier of oil to this country. So there's actually a fair amount of wealth. However, even despite that, 70% of the country live on less than $1 a day. So there's these huge disparities that occur. Now, why did I go to Nigeria? Well, out of all those maternal deaths I told you about in the world, 1 out of 10 come from this country alone. And although Nigeria has 2% of the world's population, which means it's a pretty big country, it has 11% of maternal deaths. And so there's different ways of trying to describe maternal deaths. In this country, the maternal mortality ratio, which is the number of deaths per 100,000 live births, is about 11 to 14. And you can see that here it's 100-fold higher, and actually the area of Nigeria which I'm working, it's about 300-fold higher. It's about 3,000 or more deaths per 100,000 live births. Now there's even a more sobering way of describing the same statistic, and that's called the lifetime risk of dying in childbirth. And for these young girls who are probably themselves not very far off from being the age of getting married and having their first baby, their chance of dying during their reproductive years is 1 in 13. Now, can you tell me some of the reasons you think that maternal mortality might be very high in this area? You can just call out any ideas you have.
Poor nutrition.
Poor nutrition, okay. What else?
The hospitals.
So there might be trouble accessing medical care?
Teenage pregnancy.
Right, teenage pregnancy, that's another one. So in general, all the things you're mentioning is true. There's also very high illiteracy rates and very high fertility rates. And so if pregnancy is risky, and women are supposed to get pregnant many, many times, it wasn't uncommon for me to see women with 10, 15, even 20 pregnancies. They're exposing themselves to risk higher, many, many times, which is part of why this lifetime risk becomes so high. So I'm going to take you now inside a typical village that was outside the main city in which I worked. And in this scene, there's Muslim people. They follow a tradition. They're an ethnic group that's called the Hausa people. You would see men and you would see children walking through the village streets, but you wouldn't see women. And that's because they follow purdah there, which means the women are kept in seclusion within the housing compounds, which lie behind those mud walls that you see in the back of the picture. Boys might be able to access education. Here are some boys studying the Quran, and they also have secular education. But girls are very unlikely to be educated. Illiteracy is very high, and instead they might be asked to try and sell wares that their mother have made to try and make a small amount of discretionary income for their mothers. And if you were to go inside those walls, this is what you'd see. You'd see women and you'd see children. And in this area, it's not common for a man to have as many as 3 or 4 wives because polygamy is generally accepted there as the norm. And women engage in domestic activities, child rearing. They go to get wood for fires. They get water so that they can be cooking. And the other reason I want to show you this picture is because this is the condition in which women try and give birth. 97% of women in this village deliver here. And I met with traditional birth attendants there and found out that they actually deliver pretty much alone. The birth attendants only show up after the baby's born. So imagine, if you will, a young girl who's uneducated, in a room that has no electricity, no running water, having no exposure to reproductive health care, being by herself and being far away from a hospital, and you begin to understand all the factors that contribute to the high maternal mortality rate. In fact, there is a model that's been called the 3 delays that was written about in 1994 by Thaddeus and Main, which tried to group the different types of delays that increase the risk of dying in childbirth. And they're grouped by the delay number 1, which is problems in the home. And what happens here is that if you're that girl by yourself in labor, I'll tell you, if any of you have been in labor, it's really hard to know what's normal and what's not normal. Everything about labor feels abnormal, right? You're having these pains, and that's supposed to be a normal thing. So how do you know when there's a complication? How do you know when the bleeding that you're having is too much or the pain is too much? So just recognizing a problem exists is one problem. And then making the decision to do something about it is another problem. In this area, the man is the only decision maker in the family, and he may be far away when someone's in labor. So for someone to have a problem, call to get help, and then get permission from her husband to go to a hospital when the family only earns less than $1 a day and there may be no money at all for transportation, and the village in which they live only has 1 working car for 1,000 people, that may not be an easy decision to make. So then the second delay is the delay in transportation. I mentioned to you just the lack of vehicles. The roads are also very difficult to traverse. During rainy seasons, it may be impossible to even use the roads. It's costly to get fuel, and the distance is far. But then the last issue is what happens in the hospital. What are the factors here that may be impairing the delivery of good care? And we're going to spend more time talking about this in just a minute. So I mentioned to you I'm at UC Berkeley, and the Bixby Center for Population Health and Sustainability invited me to work on a project that they had in collaboration with a group in a northern Nigerian university called Ahmadu Bello University. They created what's called the Population Reproductive Health Partnership, and they got NIH funding and a 5-year grant to try and increase the capacity of Nigerian young doctors and graduate students to study maternal mortality. And before I joined the project, they had sent out some of these graduate students into the village that you saw in other villages just to talk to family members where a woman had died. And I'll tell you, everybody in Nigeria knows someone who died in childbirth. When it's that high a rate, everybody has just been touched in some way by this. So they spoke to family members, and they learned about the delays that we talked about. But something that really struck them was that after the family had finally made the decision to get care and gotten the transportation, they told stories of going from hospital to hospital and finding that it could take as many as 4 or 5 health facilities before anyone would admit the woman for care. And then they found out that once they got in the hospital, they may or may not have gotten the care they needed. So these are stories where women had died, and this was the report from family members. So the Population Reproductive Health Partnership said, we really want to see if these stories are true. How do we validate this? And why don't we go into hospitals and really see what's going on and try and audit what the clinical care is like and see whether we can validate what these family members have said. And that's where I came in. Because I was an obstetrician gynecologist and I was doing graduate studies, they thought I'd be a good person to come and help them set up the research study. And my first role was just to go for 2 weeks, do the observations in the hospital, and see if I could help them design a study. So now I'm going to take you inside the hospital. And the hospital I went to visit is a state hospital in a city of 1.5 million people. So the conditions you're going to see are not in the most rural regions of the earth. They're actually in a place that has cities and industries and restaurants. And so it's as I said, it's not even the most dire circumstances that I saw in Nigeria. And so this is what you're seeing right now is the operating room. And you even see that there's a power supply there, and actually about 40% of Nigerians have access to electricity from the grid. But there's a problem. The grid is rationed, and they only get a few hours of electricity a day. And so when I first went there, they were having between 6 and 12 hours a day. Never do they have more than 12, but they have no control over which hours. It's all up to the government which community gets electricity at which time. When I was there 4 weeks ago, they were down to only having electricity 2 hours a day. So most hospitals will also have a diesel fuel generator if they can afford it. But the problem is the fuel is very expensive and not always available. So what I found when I was there was that they weren't using electricity many, many hours of every day. Family members are a very important component of care. You all are, probably lots of you are nursing students here. Well, the nurses have a very different function there. And in fact, family members take on quite a lot of the roles that you would expect ancillary services to provide in this country. So family members literally come and camp out in the corridors, and they cook food for patients. They go to the bedside to clean them off. They call the nurses if the patient has a problem. They wash their clothes. There is no linen supply by the hospital, so the family members have to take care of that themselves. And here's the area in which they cook food outside. And I'll throw in a pitch for solar cookers. If you guys want to come up with a nice project, it would be to provide some solar cookers for these family members, because they're literally there for days at a time, and then they have to try and get fuel to cook the food for people. Now we're inside labor and delivery, and this is the water supply. Unless you think it's the sink, if you look closely, you'll see that there's no connection between where the faucet comes in and the rest of the sink. The water supply is in that bucket. That was the water we had for labor and delivery. That was the water we had for the operating room. So standing water, not sterilized, and that's what we're supposed to use to wash our hands before surgery, wash patients, wash newborn babies, etc. Because they didn't have reliable electricity, they couldn't use an autoclave in labor and delivery, and instead they had a series of buckets that have different concentrations of antiseptic solution. And on a good day, a surgical instrument or an obstetric instrument would go from bucket to bucket and stay the prescribed amount of time. But when resources are in short supply, it's very often that they would cut down the actual timing of this and not really do appropriate sterilization of instruments. And this is the operating theater. There's not going to be particularly more gory pictures than this, but what I wanted to show you is two things. One is that you can see that there's the operating room light over the table. That operating room light was almost never on. And I've now been to this hospital about a total of 12 weeks of my life, and they just don't have electricity very often. The second thing you'll see is that there's blood on the floor, and that's because their suction machines similarly relied on electricity that wasn't provided. And so it also meant that they had to use gauze to try and make up for the fact that they didn't have a good suction system. And it wasn't uncommon that they would run out of gauze, and I saw surgeries canceled because they didn't have gauze. Now during the day, they got lighting from the windows that you see around the room, but during the night, if they didn't have a good electricity supply, there really was no light to do surgery. And I saw C-sections where the diesel fuel generator would run out of fuel, the lights would go off, and all of a sudden we had to finish a C-section by flashlight. Or there was no fuel to begin with, and they would end up telling patients, you need a C-section, but I'm sorry, you have to go to another hospital. So here was some of the reasoning that hospitals were turning away patients. This is labor and delivery. If you imagine that sink we saw was on this side of the room, if you turned yourself around, you'd see 4 labor beds. Well, if you can call them beds, they're basically tables that are metal tables, and sometimes they wash those plastic coverings, and sometimes there's no plastic covering at all. And very often I'll ask people to just tell me some of the differences they notice between an American delivery room and this one, or even just your simulation lab downstairs in this one. And the thing I want you to keep in mind is, as upsetting as it is that these are the conditions, add to this the fact that the only people who show up at the hospital for deliveries are the ones who fail to deliver at home because of complications. And you'll understand that this is just a terrible combination of factors to be putting together. You have women who have been in labor for days, or who are bleeding, or who have twins, and these are the conditions in which they're being treated. There's no monitors for the baby. There's not even a place to put the baby once it's born, other than just on the edge of these tables. And there's also very little privacy. Here's an example of someone that's giving birth. The rate of stillbirth there was about 20% of all the admissions had stillbirth. And it wasn't uncommon to have one woman give birth to a live baby, and then next to her someone have a dead baby. And I found that to be troubling. And the baby right now is lying on her clothes because there was no linen. There's not even a blanket there to wrap the baby. The other issue that really astounded me was that there was no way to call the on-call doctors in a rapid fashion. Here's a girl who was 18. She had a condition called placenta previa. That meant that the placenta was actually covering the cervix. It was in front of the baby, and the only way for her to deliver a live infant would be to have a C-section. So the way they call doctors there is to have a messenger go and look on the hospital compound, which is a little bit like a tiny college campus, and go to each of the wards looking for the doctor, and then go to the doctor's home, and if they don't find him, they just come back. And it's quite possible the doctor's very close by, but just was in a different ward when the messenger went to one. And so this particular girl was waiting 4 hours before her baby eventually died, and before I ran to every housing unit in the hospital to try and find any doctor that could come in and help. And by the time we got back, she had already lost her child. And this was not an unusual circumstance. I saw this all the time. The other thing affected by the lack of electricity was that there was no way to store blood. And so when women came in hemorrhaging, we then had to find family members, and they would only use male family members, that had compatible blood types, that didn't have AIDS or HIV or hepatitis or any other conditions that would have made them unsuitable donors, and arrange for donations on the spot. So that was yet another delay. And finally, I'm bringing you back to that light picture. This is now the maternity ward in a large state hospital in a city of 1.5 million people. And if you can imagine what it would be like to try and provide care for women who are in labor, for someone who needs a surgery, for suturing up a laceration. Kerosene is really not a terrific light source because it doesn't provide any directional light. And as you all know, if you're trying to do a procedure, a medical procedure, you want to be able to shine the light where you're looking. And so this was quite inadequate. It's also not safe. One of the nights that I was there in the darkness, someone went to pour what they thought was antiseptic solution on their hands, but accidentally picked up the kerosene bottle and poured the kerosene on her. And that went spilling on the floor in a room that was filled with patients. And what I didn't tell you at the beginning is those family members that you saw outside, they all come inside the ward at night and sleep in the same wards, on the floor, under the beds. So this was a packed room with kerosene on the floor. And thank goodness that there was not a fire, but it actually showed me how dangerous it was to have this be the light source. So I just showed you a whirlwind tour of my first 2 weeks in Nigeria. And I came back from that trip pretty shaken. And we could sit here and think about all the ways that it was challenging to provide care and why it might be that a hospital might not be able to provide care and turn patients away, or why there might be different delays. But the area in which I decided to focus on after this trip was electricity, light, and communication. I have the good fortune of being married to someone who teaches solar energy. And I was sending letters to him on the internet when I was in Nigeria that first time, describing the kinds of scenes that I just talked to you about. And he said, Laura, come back, let's see if we can work on it. Maybe we can get money from family and friends and pull together a solar electric system for this hospital. And I did come back, and as a student, I was eligible for a competition on campus at sort of a technology research for the developing world kind of competition, which was about 11 days after, no, it wasn't for the developing world, it was for the social good. That competition started 11 days after I got back from Nigeria, and they wanted an interdisciplinary team, and I literally ran to different departments, to the information technology, to energy resources group, to pull a couple of other graduate students to join me and said, would you mind putting your name on this thing? I want to apply. The grand prize was $12,500. So I wrote a white paper, and I got these two lovely grad students on either side of my husband and I to join our team. I really barely knew them. I said, I just want your name. I want the best chance of getting this thing to go through. And we got to be finalists in this competition. Now, I wish I could tell you we won and everything was great. We ended up getting honorable mention. And I will tell you, I had spoken to the head of the hospital and told them we had entered this competition. I said, we're going to try and get you solar, and we designed a system to be exactly $12,500, you know, because we were so eager to get this grand prize. So I came home after the honorable mention, which was a prize of $1,000, and I was pretty upset. And I called up the head of the hospital. I said, Dr. Moazzo, I'm so sorry. I really tried. I really wanted to get you guys solar, but we didn't win. We only got $1,000, and I'm so sorry we can't do it for that much. He said, Laura, your idea is beautiful, and what you have is a seed. You're going to plant the seed, and something will grow from that. That night, someone called who had been at the competition, who was from the Clinton Global Initiative. And he said, you guys should have won. How much do you need? And so I doubled the prize amount. I said, $25,000. So 3 weeks later, the Blum Center for Developing Economies, as well as something called Berkeley Big Ideas, gave us the $25,000, and that's what led us to do the project you're about to see. And what we decided to do was create standalone solar electric systems. So now we've sort of covered most of the medical part of this, and now we're going to get more into the engineering parts of the talk. So now all the engineering students will have something of interest to hear. What we wanted to do was design a system that would target maternal health care. So we wanted a system for the operating room, the maternity ward, the labor room, and the laboratory to power a blood bank refrigerator. But each of them have somewhat of the same components. I don't know if this light's going to work, but I would love to be able to have a directional beam. Can't show you anything right here. Okay, so if you look up at the top left, you see that there's solar modules. That's the first thing. That's the energy into the system. Then what we wanted to do was have a low maintenance system, and so we chose to use a gel cell battery that's on the lower left there. And this is a battery that doesn't require regular maintenance. Many solar electric systems use what's called flooded batteries, which require distilled water to be added on a monthly basis. But I was really concerned that with all the staff shortages I noticed at the hospital, that there really wouldn't be someone that would take care of the battery. And so I wanted something that would be much easier to use. So we chose a more expensive type of battery called a gel cell battery. The other thing I'll point out to those of you who are in engineering is that we purposely oversized the battery. We actually purchased a much bigger battery than was necessary because we didn't want the battery to run out soon. We wanted it to live a long time. And the way batteries work is if you only discharge them a little bit, they'll last much longer than if you run them down quite a bit. And so we were able to create a system where we estimate the battery will last probably 7 or 8 years rather than maybe 2 or 3 if we had undersized the battery. And then the other major components are in the middle there, something called a charge controller. That's a little bit like the brains of the system. It regulates how much energy comes in from the solar panel, and it sends that energy to the battery, but it also prevents the battery from over discharging. So it's a very important part of the system. And then we had 12-volt DC electricity that came from the solar panel and chose high-efficiency products like LED lights that would run off of DC electricity. And I also wanted to bring a communication system there, and so I chose walkie-talkies, and we adapted them to be working with 12-volt DC. Now, there was some equipment, such as the suction machine in the operating room, that couldn't work off of 12-volt DC, and so for that, we brought in what's called an inverter. That's now the bottom of the picture, and that converts DC electricity to AC electricity and allowed us to use AC equipment. And AC equipment is much more like what you would normally plug into in your wall right here. So that was the basic design. But before doing the installation, I thought it was really important to go back to Africa to talk to the healthcare providers there and find out if this is what they wanted, and were there any modifications they would make to the design, and did they like the LED lights? Would those be enough for them to do surgery? And what do they think of walkie-talkies? Was that something that they would use? And so I asked my husband to give me a miniature version of that system that I could put in a suitcase, get through customs without declaring anything, and bring it into the hospital. So this is the stealth solar suitcase. And the idea was just to give a demonstration to the healthcare providers to let them let us know what they wanted in their own design. And so these were actually some of the very first components that I put in a suitcase, and we brought with us LED lights, we brought a battery charger, we brought headlamps and rechargeable batteries so that they could use directional light, and I also brought in a series of walkie-talkies. And my idea was that I would have my husband come with me, and we would go and sort of describe solar electricity to them and educate them on this. Well, sadly, my husband had seen the pictures you just saw before, and he said, there's no way I'm going to that country with a hospital like that. You're going to have to learn this yourself. So I actually took one of his courses. I took an intensive 5-day workshop on solar electricity and learned enough that I could kind of hook up the wires there to show people the system. And I had put a picture, I guess something, I'm on a slightly different show than I thought. But anyway, I brought it to the doctors and I said, this is what I'm thinking of, what do you think? And not only did they like the idea, they said, could you leave the suitcase here? And I said, oh no, this is just a demonstration. I wasn't supposed to leave it here. They said, please, this would help us so much. So if any of you are doing research, you'll know that it's really good to get a baseline data before you do an intervention. So the researcher side of me thought this was not a good idea, but the humanitarian side of me said, you know, this is really going to help. And I already saw when I was there how the lighting was really improving their ability to do care. So I wrote back to all my colleagues at UC Berkeley and said, let's take a vote, what do you all think? And so we ended up leaving the suitcase and calling it phase 1 of the project instead of the baseline. So phase 1 was basically using rechargeable batteries for headlamps and also using a walkie-talkie system. And here's some pictures just showing you the difference that it was like for nurses who were trying to write notes at their desk before and after. Here's nurses trying to start IVs. This picture on the left is a candle, and that's in a room called the eclampsia ward. So it was a whole room of eclamptic patients, some of the most high-risk patients you could ever deal with in the United States, and zero light. And this nurse was trying to start some medication. There's a medicine called magnesium sulfate, which helps to reduce seizures, and she could not start the IV. And so I gave her the headlamp, and you can see that even just one little LED lamp on a headlamp can make a difference, and so she was able to start medication. And here's the before and after pictures of surgery. This was taken about 5 o'clock at night when there was some ambient light on the left, and then I put a headlamp on someone, and a minute later, that's the type of visibility they had. And similarly, we gave walkie-talkies to all the people that were essential for doing emergency C-sections. So the midwife, the surgeon on call, and then this would be the surgical nurse. And so no longer did we have to run around not only getting a doctor, but getting the surgical nurse, who was the only one who had keys to the operating room, because that was another source of delays. And what we ended up seeing from that was a reduction in delay for care. People liked what they had very much, and they actually said, could you bring LED lamps for the rest of the hospital? So this is now phase 2. I just want to let you know there's a few seats down here. If anyone would like to sit in the front, there's like 3 over here. You're totally welcome to come down and not stand. So we started phase 2, which was to do a bigger installation in the hospital, but we also gave headlamps to the rest of the hospital because they were quite jealous that the maternity ward had gotten all the attention. And here's an example of the PV installation. At this point, we had larger solar panels that were being put on these stands against the wall of the hospital, which was concrete. And here's a picture of the lights in the maternity ward before and after. And we put in our design a combination of fluorescent lamps and LED lamps, thinking that the fluorescent were good but used a little more energy and the LED would just be our backup lights. The nurses ended up telling us they actually liked the LEDs better than fluorescent lights. So I switched the design while we were there, and for the operating room we only used LED lights. So here's the operating room before, and this is now with 15 watts of power. So 4 of those LED lights on the ceiling each use about 2.5 watts, and then we used 1 LED lamp right over the operating table that's 5 watts. Does anyone know what a typical wattage is for like a light bulb that you would have in your house and a lamp? Yeah, so you hear 60 or 100. This is 15 watts of power. And that's one of the principles of doing standalone solar, is you really want to minimize your loads, minimize how much energy you're drawing from the system, so you don't need to have an extravagantly big system to begin with. But we were really pleased that the LED lights worked this well. And then the walkie-talkies that had been used, the doctors had asked, could we extend the range? And so I had just a wonderful sort of radiophile person create sort of a booster system where he took 2 radios together and augmented the length, and then I carried with me on the airplane an antenna. We put that up, and that gave us a 12-kilometer range for the doctors to be called when emergencies were needed. And then here's a picture of an inverter where the arrow's pointing, which was allowing us to then utilize the suction machine. And finally, we brought in a solar-powered blood bank refrigerator that used 12-volt DC, again, trying to lower the load. A regular refrigerator uses a huge amount of power. This 12-volt refrigerator used 40 watts, but it only turned those 40 watts were only needed parts of the day because it sort of goes on and off. It was highly efficient. So what did we see? We actually saw that there was an increased capacity to take care of patients. They were no longer turning people away, and the average number of patients went from 150 a month in the maternity ward to 180 a month. They could do blood transfusions more quickly. They could immediately assemble the surgical team. And I know this is hard to believe, but the maternal death rate went down more than 60%. Now, I don't really usually talk about that because it's really hard for me to believe that anything could have that type of result. So I was writing a proposal for something else this week, and I called another hospital that we brought solar to just to find out what their statistics were like. They told me at the other hospital that they were seeing before the solar about 1 woman die every month in the facility, and now they have 1 to 2 every 6 months. And so I actually did the calculations, and it was about a 60% drop. So even if that's an overshot, it's doing something. You know, even if people are on best behavior, it's doing something. So I asked this doctor this week in Nigeria, who was the medical director, I said, was there anything else accounting for that drop? You went from 1 a month to 1 or 2 every 6 months. He said, oh, yes, there's something else. I said, okay, great, what is it? Assuming there must be something else. He said, well, the healthcare workers feel much more confident now, and they're much more motivated to work because they have light at night. And they're not afraid to do their job. So I was pretty amazed. I mean, people would tell me quotes when I'm there like, we no longer feel fair night duty. And at the hospital where you saw the big installation, that became the social center at night because it was the only ward that had light. And one of the hospital workers called it an island of light in a sea of darkness. So at that point, I kind of thought initially that was going to be the end of the story. But it turned out that word spread about the solar, and other clinics in this same city said, why is the hospital the only one to get solar? We do deliveries too, and don't we count? And initially I said, oh, this is just my husband and I's idea. We're really not a big organization. You really got this wrong. But I got brought by the ambulance driver at the hospital to some of these clinics and got to see what they looked like inside and realized that indeed they had every much a right to have good infrastructure as did the hospital. And so we ended up deciding that maybe that little demonstration system, the Solar Suitcase, would be something that would be an easier way to get solar in, certainly much less costly because the components were about less than $1,000, and a way that didn't have the expense of that $25,000 system. And so we began bringing these solar electric systems to health centers. This one that does about 700 deliveries a day. And when I went back last month to interview them after they've had the solar and spoke to the midwife, she said, you know, we used to try and sew up lacerations by candlelight. And she said, this is just a completely different way to work. We can finally see what we're doing. And absolutely, we're saving lives. And here's midwives learning how to use the headlamps. And now this is a hospital, the small hospital I mentioned to you where I spoke to the medical director just this week. They had an operating room, but they could never use it because they never had light at night. So they had the skill, but they couldn't use the facility. That is one 5-watt bulb. So that can be powered off of the little suitcase you have here. And they now don't have to transfer patients out at night. And here's another clinic that got a solar suitcase, and you'll see that there's sort of different renditions of the solar suitcase as we got more used to making these and more practice, and actually more people involved in the project as well. And here's inside one of the clinics, one of the midwives using the light at night. And what ended up happening is, I could have said the story stopped there, but it didn't stop there. We actually got some coverage from the New York Times, from National Public Radio, and without doing any marketing whatsoever, started getting requests from groups all over the world asking us if we could bring a solar suitcase to their facility. Now this is basically a cottage industry with my husband and I and any volunteers who want to join us making these things from our house. But we ended up deciding that if a group was leaving from the United States and we could train the person leaving and give it to them to stick in their suitcase, we would make one for them. And we started to do fundraising and we started making suitcases, and we now have them in 8 different countries, and I'll show you a couple of pictures. In Rwanda, they brought the solar suitcase to a health post in a village that had 0 electricity whatsoever. And the day that they installed the panel, they made their own little mounting structure for the panel on top of that roof. Everyone in the village came and sat on the hillside watching this installation, and it's now the only electricity that's there in the village. There's a project in Mexico where the Tarahumara Indians live in a region deep in canyons. It's called the Copper Canyons, and they don't have any access to electricity whatsoever, and the maternal mortality rate of this population is identical to that in Nigeria. And so One Heart Tibet is a group that decided they wanted to improve maternal mortality and asked for a solar suitcase, and we're now using them to power walkie-talkies so that when women have birth complications, they can call for help and get transportation to hospitals. And we're testing this out in India. This is a family planning clinic there. We're actually going to be looking at using a modification of the solar suitcase for telemedicine clinics, which are clinics that allow people in rural areas to get attention via computer and being connected to doctors who are skilled in larger cities but who aren't able to come out into some of these rural areas for care. And just last week, we gave a solar suitcase to a doctor who's working in Thailand training Burmese midwives to walk 10 days into the jungle and set up maternity clinics. And so we actually modified the solar suitcase so they would fit in backpacks. All right. Polly asked me if I would talk about some of the challenges of this project, because I know I've made it sound like a very sweet story, but it wasn't without its challenges, which have been occurring in the past and still keep occurring. And so I'm going to show you some of the difficulties that we've faced. It's really important when you're creating a technology for other places that you evaluate how it's working, that you get feedback from end users, and that you see whether people are really understanding the information that you're bringing them, and that finally that these things can be maintained. Africa is littered with unusable equipment because very well-meaning people from Europe and America dropped large pieces of equipment into systems that either didn't have electricity or had no capacity for maintenance, and so they sit like these relics in storerooms but never being used. So it's really important to think, as you're building a project like this, of how you can try and maintain systems over time. So you remember I talked about that big solar installation that we did, the $25,000 one? For that, we actually hired some Nigerian installers because I thought it was important for Nigerians to get the work. And I interviewed 7 different companies and actually met with these installers before I hired them. Even with all of that process of vetting these installers, the workmanship that was at the end product was really not very good. And one of the things I learned is that your installation is really only as good as the weakest link in the system. If the person who is hammering or screwing something in didn't do a good job, that can bring the whole project crippling, can cripple the whole project. So this is now 8 weeks. If you look on this on the left, 8 weeks after the original installation, that AC outlet that was in the operating room was flapping in the breeze. It had totally come off. The operating room light that they installed, I told someone I needed an operating room light. This is 1 minute after they were finished with the job. They made the light so low it would have been literally sitting in the patient's body. It didn't occur to me to tell them, gee, keep it above the table. I was sort of trying to let people make their own decisions along the line. I said, oh, that's really wrong. We have to shorten it. So they wrapped it up like this and tied it in a knot. And they said, now it's adjustable. And left. Here's an example of the battery chargers that we brought. We brought in rechargeable batteries because my feeling was I wanted a system that wasn't going to cost anything for people to keep using it. I saw how the need to buy diesel fuel or the need to buy little charge cards for people's cell phones were prohibiting people from using some of these things. So I wanted anything that we gave them to basically be free to be used. So we brought these blue rechargeable batteries. But people started using regular batteries in the battery charger, and they literally broke the battery charger because they were leaking acid. So that showed me that I wasn't really clear in imparting that knowledge to people to use the instruments correctly. And then this is what happens when you bring in electricity to apply to a country that doesn't have a lot. This is the operating room. And when I got back, I saw that everybody charged their computers, their DVD players, their phones. And this is supposed to be the sterile room that people are having surgery. There's a couple of issues. One of the issues is that you need to really understand how people are going to use things, and it's unfair to expect that people wouldn't want to charge their cell phones. Why shouldn't they? And so either you design a system by really spending time talking to people, or you go back and then you make modifications as you see how things are actually being used. And I would say that anybody putting solar electric systems in, when they're calculating their loads, they should really think about usages like this, because it's very likely. I've spoken to people now who have done projects in many parts of the world, and I hear this over and over, that there's just this intoxication when people finally get access to electricity. And then there's that solar panel I showed you in the earlier slide. And if you look closely, you'll see that the entire thing was basically hinging on that welding joint. And it turned out that the company thought they were doing a really nice thing for us. They had never tried this pole mount before, but it turns out it wasn't appropriate for the load that they had. They didn't think it through. And so this is now, again, when I came back 8 weeks later to check on the system. And so we ended up moving all the solar panels to the roof of each of the buildings, which had its own problems. After I got back, I got a phone call that labor and delivery was now leaking water through the top. So each of these things just have to do with issues of workmanship, and it showed us that at least at this point, the more we can do to control issues within our own solar suitcase system, the better, because we can sort of troubleshoot ourselves and try and avoid some of these problems with workmanship. What we've been doing now is to try and find solar panels that will actually fit better into suitcases, and our ideal would be to find some sort of panel you could really fold up and fit inside a very small suitcase. Our suitcase has kind of shrunk as this project has been evolving over the last 2 years, but this is Charles Liu, a Chinese solar manufacturer in California, who tried to design one that would fit in regular carry-on not carry-on luggage, but checked luggage for us. And then there's a number of issues we've been trying to research. One is what's the most efficient and durable LED light bulbs. The initial light bulbs we brought in the first hospital system were about $30 to $50 each, and many of them had failed within 2 months, even though they're classified as being good for 50,000 hours. We're now using the lights I'll show you in just a minute, which are $8 and $10 each, and they have had no failures in a number of months. And so price doesn't necessarily go along with quality. We also decided we wanted to make the system more plug and play. That very first demonstration project required me taking screwdrivers and putting wires in and out of the charge controller every time we tried to hook up a solar panel. Now we want to make something so easy that any healthcare worker would be able to put this together, and I'll show it to you in just a minute. We're also looking at other types of batteries. This is a lithium iron phosphate battery, which is a lot lighter to carry, and that's a Chinese charge controller on the front, which is a lot cheaper than the one we're using, but we need to field test these and laboratory test them actually to see how durable they are. And then we're looking at other products that can enhance maternity care. Here's an example of a portable ultrasound. It allows you to see the baby and diagnose conditions during pregnancy, and so we're working with the manufacturer to try and adapt that for use with our suitcases. So some of the lessons that we learned from this project are how important it is to assess the needs in the field, that the system is only as good as the weakest link, so it's really important to do that field testing. It's really important to bring extra supplies. I was telling people at lunch today, if you don't even have a screwdriver, that can be a 2-day exercise just to try and find something there. When you're going to very rural areas, don't assume you can get any replacement parts. So it's better to bring extra with you just in case you need it. And it's very important to train staff, and it's helpful if you have someone in the hospital who's a local champion. It's important to have materials for people to read after you leave. And that maintenance is the key to sustainability, and that's one we're still working on as an issue right now. So I have just a few more slides. I just wanted to tell you a little bit about my experience trying to grow an organization. The little girl on the right is my 8-year-old, and when I was in Africa on one of my trips, she and her neighbor on the left went out and sold lemonade and cookies to raise money for We Care Solar. So we've had everything from a lemonade stand as a fundraiser to, this is just amazing. These are boys, high school students in Boston who heard my interview on NPR and decided to have a rock concert to raise money for We Care Solar. So they played music, and I was just so moved I came out to give a presentation for them. 7 different groups of rock groups played for a night and raised enough money for a solar suitcase. And we took the money and gave it to supply these high school students in California who wanted to make them. One of their teachers was an engineering teacher who took a course with my husband, and I came in and gave a guest lecture like I'm giving you now about We Care Solar. He said, this would be a fantastic project for my high school students. And so we taught him how to make the suitcase, and he's the one that actually upgraded the design from kind of the sloppy job my husband did initially to a much nicer job the high school students did, and that's one of their suitcases I brought with me right now. Then this student is another high school student who has a club that he started that does a lot of solar technology products, and he took a class with my husband, and he said, I want my club to do this, and this is now my dining room floor. He and his friends made 10 of the components for the solar suitcase for a relief effort we're doing for Haiti right now. And my husband also tries to help develop programs around the country to teach solar electricity to people, such as people that are in the audience in the very front row. There's people from a group called The Choice Is Yours that's trying to empower young people and displaced workers to try and get a second lease on life. And so part of what they're doing is to teach solar curriculum, and they, along with other urban leaders from the country, came to a course my husband was giving. It just so happened that the earthquake in Haiti happened the same week. It just so happened I gave a lecture to that class the day after, and the students said, hey, this would be a great project for our students as well. And so we ended up spending that Saturday making solar suitcases in our backyard. And this is now my living room, which is turned into an assembly plant. So I'm going to show you the suitcase in just a minute, but what I want to just talk to you about right now is that this is this little girl that was in that hospital I showed you, and I loved her face. And what this picture says to me is sometimes it feels like problems are insurmountable, like you're just really trapped. And I tried to show you how there's a lot of issues going on in Nigeria, and that the issues of power, lighting, communication are really hindering care. But sometimes the solution is just around the corner, and there is a way out if you just change your perspective. And that's what we've tried to do with this project. And I thank all of you for your attention. I'll be here answering questions. But before I do, let's put the lights down just for a minute so you can get a sense of what this little suitcase can do. And I brought with you the actual light that we use in the operating rooms. This is a 3-watt bulb. And so now, remember how I told you initially that there were these 5-watt bulbs in the operating room? This is adequate light to do surgery. And so this is now what we're using both in Haiti and that we're using in all these other parts of the world. And we have another type of light that provides a more ambient type of light, because that one is a very directional light. And this one is just more general light. So this is kind of what they're using in a lot of the rooms. Sorry, how do you want me to? All right. Now who wants to do surgery on me? So why don't we turn the lights on now, their overall lights, and I want to show you a little bit more about this suitcase system. So this is the Solar Suitcase. And what it has in it, this is like the oohs and the ahs. What it has in it is a lot of the things that you saw in that very first picture of design. It has breaker switches. It has a little charge controller, actually the same charge controller we're using in the big hospital. It has the world's tiniest battery. This is a particularly small one that I brought just because I had to carry it on the plane, but it's a slightly larger one we use for our starter systems. There's a fuse block here. That's for DC fuses. And then there's these outlets that you can use to plug in the lights or to plug in anything that you could plug in with a DC receptacle, the kind you'd see in your car for a cigarette lighter. They're called cigarette lighter receptacles. And that's what we use to plug in things like this walkie-talkie, which is what we're using now for communication. So that's what you would use to turn that on. So I need someone to come up here because I told you we have to make this easy enough that even I could use in Africa. So who'd like to come up, and I'll just show you how you would attach the panel. Come on up. Okay, so here's a solar panel that was designed by that man you saw, Charles, and you see it's a shape that would fit a little bit easier into a suitcase. Maybe someone could just hold this up. Would you like to come over here? Come, you can just hold this up. No, because you're going to do the hard part. Come over here. The surgery. Yeah. Okay, so I told you we're trying to make it user-friendly. So what you would do is put this outside to collect sun, and this is a 20-watt panel. We often provide 2 of these, so you'd have 40 watts. And then we've tried to make it plug and play. So see if you can figure out what to do. I'll give you a hint. It's color-coded. Okay, so that's it. The system's ready to go. Okay, so I need somebody else to come and turn it on. You want to come up in the front? So what you need to do is just turn these breaker switches on. Mm-hmm. All right, and now see if you can plug this in. Okay, you want you to hold that up. There you go. That's all it takes to get the solar electricity going. And so we're really just trying to make a system that's just going to be really easy for people to use. That's going to be about as easy as it is when you open your own computer. You don't have to really know how it works in order to have a computer. But the other thing we're doing is we really think it's actually a great teaching tool, because what it allows people to do is see very easily what the components are of the system. And if we can get high school students to do it, and kids who have not been successful in their schools and have dropped out to learn to make these, then why can't we have people in Africa and India and Thailand make these themselves? So as much as I love the fact that we're getting volunteers around the country making these, and I think that's a great step for right now, what our goal is in 5 years is that these are going to be made by the people who are using them. and that they'll probably be using them for a lot more things than just maternity care, because I will tell you, when I walk around with this case now in Nigeria, I'm like the Pied Piper. There's people just tracing me. Because if the hospital doesn't have good electricity, it means people who are at their homes don't have good electricity. So people can't check their email at night because they can't get power for their computers. Or business people can't stay open at night to work on their crafts or to sell things because they don't have good electricity. So we've been getting a number of requests for these from lots of industries, but being an OBGYN, I'm dedicated that my biggest priority is that we really improve maternal and child health care. And thank you all for listening. Yeah, I saw you raise your hand. You were helping. Did you have a question?
No, it's actually a comment.
Okay.
Two comments. One, thank you for the work you're doing, and I'm also from Nigeria.
You are.
The reason why I got into nursing is to bring health care to my village, which is not northern Nigeria, it's more southwest.
What state are you in?
Lagos.
That's in Lagos State. Mm-hmm.
Yeah, we have, I'm not sure the numbers, but we do have the same issues with healthcare, electricity.
And Lagos is actually a very big city. I mean, it's like the New York of Nigeria, and it's just amazing. I haven't been there yet. I've been invited to go. That people tell me the same electricity problems happen even there, where they have a lot of very wealthy people.
There's only one electric company for the whole state.
For the whole state, I see. Well, I'm glad you're getting nursing care, and maybe you'll be able to help bring this to clinics in Africa in the future. Yes.
Where, for the solar suitcase, where do you put the solar panels, and is it hard to find a safe location for them? Is there any issues with like structure?
Yeah, so there's issues with everything, but the question was, where do we put the solar panels, and are there issues with theft? And what's been very interesting is that we have not had any issue with theft yet. I mean, I'm assuming at some point we will, but these health clinics are so grateful to have light. And the midwives are caring for patients round the clock, so they never leave the stuff completely unsupervised, but they guard it with their life. I mean, they do not want to go back to a situation of having candles. In fact, one of them told me that one day that one of the wires was loose and they didn't know whether or not there was going to be some sort of problem with the suitcase, and they were so scared about having to go back to the situation that was before. This took no learning curve. The other thing that took no learning curve, the first no learning curve was no learning curve to see how much better it is to work with light. The second one is that the moment we put these in the hospital, it shifted the whole entire communication network between nurses and doctors. Because if you have to send a messenger to bring a doctor back, you can imagine you're only going to do that if you need them physically there. But if you have a question or you want to give feedback, you're not going to have the messenger go for that reason. So now instantly there was a way for people to communicate on an ongoing basis. And again, it wasn't anything I said, gee, now you could call for these reasons. I mean, by the time I came the next day, the nurses were ecstatic. The doctors said, gee, there's no hiding anymore because their lives were just shifted. And we actually have to work with groups so that the doctors don't get too burned out, because you could have a sort of unintended consequence that people will feel overloaded when they're already stressed to begin with. And so to teach when is it appropriate to call and when isn't. But I found that very interesting about how quickly people shifted their behavior. As far as you asked about mounting these, this isn't one of the ones we've actually put in the field. The one that we have has edges on the side that make it a little bit easier for mounting. But at this point, we haven't designed a good mounting structure, and it's actually one of the issues we'd like that engineering students to get involved with, is help us think through how should we mount this in different areas, because there's different roofing structures. You can't just make a uniform solution that's going to work in every country. In Burma, it's going to be thatched huts. In Nigeria, it may be corrugated metal, and somewhere else it may be wood. And so we need to say what's going to be the right system for the right environment. Do we try and create a one-size-fits-all solution, or do we just acknowledge that we're going to need to create different solutions for different countries? And I just found out today that there's a group in Berkeley, a group of mechanical engineering students that are helping us with one element of design, but then there's a group in Saudi Arabia that's going to be trying to look at what are the different roofing structures, and they're going to help us design at least one solution for one type of roofing structure. Yes.
What type of material is being used for the solar cells and how expensive are they now?
Oh my goodness. So the panels that we used to buy are, the ones that we used to buy were $200 for 200 watts. And what happens is when you buy small panels, they tend to be more expensive per watt than if you have a larger panel. This manufacturer was able to give it to us at a much reduced rate. So about $60 to $70 for the same amount of electricity, and they're using monocrystalline, I believe. And what they've done with these is they're taking old, damaged US panels and cutting out the remainder and getting enough good material and then kind of putting those together for these. So it's American panels that are then the material shipped to China, put together and used here. So it may not be considered the A grade panels, it may be B grade, but it's fine for what we're using. Yes.
You mentioned that your suitcase got smaller and smaller as this project went on. I was just wondering if that was mainly because your solar panel dimension went down or not, and how small have you gotten the solar panel down to where it's still efficient for the use that you need it for?
You know, my idea initially was that I wanted the suitcase to contain the panel, and so the problem is that even when that manufacturer tried to work with us, the smallest one he could get for 20 watts was this dimension, which is just like 1/4 of an inch more than you can fit on carry-on luggage. And so once we realized that we would have to go to the larger size luggage, we stopped trying to work on making a carry-on type case. And so then we worked on just trying to reduce what's called the balance of the system, all these other components here. And it was actually the high schoolers in Elk Grove that came up with this case. One of the fathers donated 10 of these cases to the project. And so this was sort of a new improvement, that we actually had a nice case it fits in. And then now we've gotten some other cases that are not made of this material. They're plastic, but they're slightly bigger, and that's what I'm using for the Haiti project. What was the other thing I wanted to tell you? Oh, there's another thing about this, which is that the panel that's inside, if you were to take out the battery, it actually lifts out. And one of our ideas with this is that we want it to be modular, and that we want the system to be able to grow for clinics that have greater needs. So you can actually take this board, hook it to your wall, and then plug it into a larger battery, and then take a larger series of panels and get much more power than you can from this one here. Yes?
I'm curious that this battery has the same AH as the gel battery, or it has lesser than?
It has the same what?
AH, ampere-hour.
Oh, you can get whatever size, sorry. The one you saw in the picture was a much bigger system, and we have lots of choices of batteries. We have gel, AGM, either of those would work with this, and we just choose a size that fits the loads for lights and communication equipment. What we really do is when, like in Haiti right now, we've been sending them down for Haitian relief efforts, we just need to characterize how much are they using during the daytime, how much are they using at night. If it's mostly nighttime use of these systems is for the lights, we don't need a larger battery. But if they had a lot of needs at night, this one would need to be expanded, and you'd need to have expanded panels. So you can make these in any size. This happens to be a 7 amp hour battery. We usually put a 12 amp hour battery in here. And in Nigeria, I converted some of the systems to a 20 amp hour battery. So it all just depends on how I see the use, how people are using them, and what the needs are. Yeah.
It looks like they're just supposed to lay the panels out. Do you train the users to try to orient it towards the sun or to optimize performance?
So absolutely. So the question is whether we do any type of training to orient people, and clearly these are going to work much better if they're facing the sun. And sometimes it can be very sunny in the morning, but then as the day progresses, there can be shading from another building or from a tree. So we ask people to initially look at the panels every couple of hours and see whether there's still good sunlight on them. And if they can mount them on top of a roof if there's not any obstructions for light over there. What was the rest of your question? I don't know if I...
Oh, no,
that was it. There was something else I was going to say. People have been very creative. I just saw the system I visited last week. We hadn't told them exactly where to put it, and they made something out of wood that stuck out like this, like a shelf on the edge of their building, and put the panels there. And I wasn't there long enough to see what was going to happen during the whole day, whether it would be sunny for the whole day, but that's something we do try and train them in. Yes?
Depending on weather conditions, like if you don't get a full charge or it's not out all day, how long will the system last?
Okay, great questions. And I forgot to say one other thing. One of the bigger issues for this is dust in a place like Nigeria. And so we also teach people to wash these off. If they don't wash them off, it's a little bit like if you have glasses and there's dirt on your glasses, you won't see as well. Well, these won't see as much sunlight. What was your question again, though?
Depending on what conditions, you know.
How long does it last?
Not
So
sure.
if you power this with one of the 12 amp hour batteries, it'll give light like this for 30 hours, or 2 lights for 15 hours. And we have 2 units here, so what we often do, what I wanted to do was to make sure the light was going to last through the night, because of course deliveries can happen any time of night. So this actually will allow us, would you hold this for a moment, Polly? So this would allow us to have 2 lights going at once, and we give them some backup bulbs in case they break. And what we send with them is like a goodie bag. And so I basically at home, remember you saw that picture with all the stuff on the floor? Part of that stuff was extra light bulbs, these cords, extension cords so they can extend it. And then I include these solar powered flashlights. Have any of you seen these? This is from a company called BOGO. BOGO is buy one, give one. A pretty good beam of light. There's different settings here, but these have actually been used for nurses putting in IVs as well. And so we basically decided, in addition to the lights, we wanted to have some extra backup. So we give them headlamps, rechargeable batteries, a battery charger, and a couple of these. So if there happen to be times where they need to go outside of the ward, or if it's been a rainy season and they don't get as much light, there's other ways that they can have backup lighting as well. Yes.
How much you said off the
So this whole system with the goodie bag has anywhere between $800 and $1,000 worth of components in it. And right now, every ounce of labor and love that has gone into this has been volunteered, so there have been no overhead costs at all. Our facility is my living room and dining room and kitchen and bedroom and backyard. Yes.
Have you had any trouble taking them on the plane?
No. And the only trouble I have had is coming here. The large suitcase I put it in broke and something was damaged. I had taken this out. I put it in my regular luggage, and one little piece of this plastic was broken, and your engineering department actually took care of it this morning. So that was the only problem, but it's gone all over the world without a problem. And we've always been able to just bring it right through customs without declaring it. I don't know what would happen if they actually opened the suitcase. I mean, I probably would be telling you this from a jail cell in Nigeria right now, but I was so scared the first time because I had all of these walkie-talkies. I had stuff that looked like a bomb, you know, and I said, if they open this up, how am I going to explain what I'm doing, and will they ever believe me? And if they lock me up, who's going to know, you know? So that was my scariest time, but once I've done it, actually now in customs, they just know me as the solar lady, so they just let me go in and out pretty easily. Yes?
What's the average power output for your solar panels?
Power output as far as efficiency? Is that what you mean?
Like how much watts are you generating?
So it just depends on where we're putting this, what the latitude is, and whether or not, how many hours of sunlight. Many of the places that get these are very close to the equator. They have terrific sunlight. So in Nigeria, they have on average about 5 hours of sunlight. And usually we give them 40 watts of power. So that would be 200 if you multiply the two together, 200 watts, 200 watt hours. Now, the reality is there's inefficiencies in any system. And so instead of telling them that they have 200 watt hours, we tell them expect maybe more like 100 watt hours, and that way we're not going to be cut short. But as each piece of this goes on, as you sort of move through the charge controller and the battery, and then inefficiencies in the battery and the wires, you're not going to get a full 200. The other thing is that these panels are probably better and more efficient when they're newer, and over time the efficiency may go down a little bit as well. So we try and lower the expectation and have people be pleasantly surprised rather than telling them it's a whole 200 watt system. Yeah.
From all the countries you traveled to, did you find someone that knew English, or was there?
Actually, Nigeria speaks exclusively English, and I don't want to say that I actually traveled to all those countries. These have been, other than Nigeria, these have been brought in either by people who are on our team, like the India one and the one in Uganda, or people that have been associated with us and we care, but other ones were just people that were on medical missions or worked for a nonprofit and said, hey, can we possibly have one? And we just either give them away for free if we can, or if people can pay for the supplies, great. That helps us to make more of these. But I'd say so far about 75% of them have been just given away by donations. Yeah.
As your project grows, do you have any plans on trying to, I guess, stimulate change in the countries that you're going to maybe get electricity more available?
So it's a really interesting question. The question is whether or not I'm going to try and work more generally on trying to stimulate change. And first of all, no, I haven't really thought of sort of taking political action on that level. But the other thing is just the question of how do you work with other countries, like a country like Nigeria, which, sadly has a fair amount of corruption. And some people say, well, how are you working with the government? And the strategy I took was sort of go in under the radar screen first and then give the government the credit. So when we did the first commissioning of that hospital, we invited the Commissioner of Health. He came to a ribbon cutting ceremony. The newspapers were there. I said how great it was that they were letting this project happen, how great it was they were letting us do the research and sort of creating a sense of partnership, which they were then very proud of because they got to take a lot of credit for this. I've met subsequently with the governor of a Kaduna state actually just a few weeks ago, and they've asked now for us to bring these to 700 clinics in the state. Not that we have the capacity to do that yet, but they're waiting for our proposal. But I don't know what role I could play in trying to make the entire country do a better job with electrification. There are so many issues involved, and it's certainly not my area of expertise. And the other thing about it is there are a lot of people that actually gain from not having the country electrified. At least this is what my Nigerian friends have told me, that the people who make generators and who sell fuel, they don't really want the whole thing electrified. So there are just so many levels of issues that I don't think that I'm the right person to qualify. On the other hand, I think bringing it to the attention, like I addressed the state assembly in Kaduna State last year and told them about the stories I've just told you about what it was like getting care and brought it to their attention. So I can tell you that people who are high up are very aware of this. But I would rather just sort of keep quickly doing what we're doing in clinics and getting things out there than being tied up in a lot of red tape and bureaucracy and maybe not getting anywhere. Yes?
Kind of a similar thought before she asked that question is, you may not have thought this far in advance, especially since this has been happening quickly, but everything has a lifetime, even solar. So have you put any thought into, or have you formulated any ideas for what will happen with the continuation of this? Like you said, I think you said something last 7 to 8 years that
So when we estimate how long the different pieces of this will last, the panels that we use, which aren't these, we have glass panels that we're using right now, those are estimated to last about 20 plus years. The charge controller, we're not sure there, but we've been using this particular charge controller in American houses for 10 to 15 years, so we're hoping we can get 10 years out of it. The batteries we think need to be replaced every 2 years, and the rest of the components are pretty stable other than those light bulbs which may need to be replaced. So what we're telling people is to expect to change your batteries every 2 years. We're thinking that as we have larger supply of these to areas, we'll probably bring in extra charge controllers. If any of them break, just replace those, but make sure that there's supplies in country to do that.
I just hope that by the time that time comes around, there will be more advances to help them continue.
Yeah, and the other thing about it with this particular design, because you can see each of the components, let's say there's a much better charge controller that's a third of the price in 3 years. Sure. Well, as this one breaks, you just replace it. You don't have to replace the whole system. There's a number of systems that we looked at in Africa. We don't have as much wattage, but it's the whole idea of a comprehensive electricity and lighting system, and they kind of package them in these sealed boxes, and so if it breaks down, all you can do is buy the whole new box, and we really wanted to make it a little easier for people to swap out components if they wanted to.
Okay, I think if we have more questions, we'll do that. Come up afterwards and also come up and take a look at
Yeah, play with it.
the Solar Suitcase. Visitors, we give them some memento to take back with them, and in lieu of mug from Villanova, basketball signed by Jay Wright, what I have for Laura is a check that we'll give as a donation.
Oh, thank you.
For BK Solar.
Oh, thank you. Group shot, because I always put a picture of the donor inside the suitcases. I need the picture of everybody. Maybe you can turn around and take a picture of everybody. So we'll have your picture go.
Anyone who's interested in helping out building some of these solar suitcases, you know where to come to.
Yeah.
Thank you all for coming. It's really been a wonderful turnout.